Okay, for the knee evaluation, same thing. I'm going to start with my history. I'm going to ask the mechanism of injury. I'm going to find out what happened. I'm going to find out when it happened, whether it was chronic or acute, whether they've had any previous knee injuries before or surgeries, whether they felt any unusual sounds, heard any unusual sounds, or felt any unusual sensations, and to tell me exactly what her main complaint is right now. Then I'm going to visually inspect bilaterally. I'm going to look at her gait as she's walking into the athletic training room or the facility that she's at. I'm going to look for bilaterally for any swelling, any deformity, discoloration, bleeding, any scars or abrasions from previous arthroscopic surgeries. And then I'm going to begin my palpation. I am going to start at the joint line. I'm going to find the joint line by locating the two dimples. I'm going to go around the joint line. This is where the meniscus is, where the cruciate ligaments would be if they're swelling right through there. I'm going to find the medial and lateral epicondyles. What's important there is the attachments of the LCL and the MCL. I'm going to straighten the leg out, and I'm going to palpate the patella. I'm going to notice its alignment, how it's riding in the groove, whether it moves nicely or not. I'm going to palpate the fibular head, so I'm going to go on the lateral side, down below the joint line quite a bit, about an inch or 2 inches down below. I'll palpate the head where the lateral collateral ligament attaches. I'm going to palpate, I'm going to find the joint line again, and I'm going to palpate the MCL on the medial side. And then I'm going to palpate the LCL, again find the joint line on the lateral side. It's that big ropey structure that's right through here. I'm going to palpate the patellar tendon. If you have tendonitis or any issues there, any swelling or thickening of the tendon or point tenderness. And I'm going to palpate the hamstring insertions in back to rule out a hamstring injury instead of a meniscal tear, which are commonly confused. On the lateral side, I'm going to go down the IT band, checking for tightness or pain and irritation there. And then I'm going to move into my ligamentous testing. So I'm going to have you lay back on your back. And for all of these ligamentous tests, you need to ensure that their hamstring, their quad muscles are relaxed. You don't get a false negative test. So the anterior drawer, I'm going to put my thumbs on the joint line, grab my fingers behind and pull forward, looking for an anterior movement of the tibia on the femur, which would indicate an ACL injury. If I were to stay here and push posteriorly, that's a posterior drawer, checking for PCL tears. You're going to do a Lachman's test. A Lachman's test just brings the knee into about 20 to 30 degrees of flexion, and I'm going to stabilize my hand on the femur and draw the tibia forward. Again, it puts the knee in less flexion, so it's a little easier on the person. I'm going to do another PCL test, which is the Godfrey's or the SAG test. So what I'm looking for is if the PCL is not intact, it'll allow the tibia to slide backwards, so I would look for a little divot in the tibial tuberosity. And then I'm going to do my medial and lateral collateral ligaments check. I'm going to have her do a valgus stress test first. So with about 20 degrees of flexion, I'm going to isolate the MCL and straight extension. I'm going to get MCL on some capsular structures. For the LCL, I'm going to do a Verus test. So I'm going to bend it to about 20 degrees and apply my pressure. Notice my hand for both of them is right along the joint line here. So 20 degrees flexion and then full extension. Again, I'm pulling the leg in or out, depending on which way I want to go. Neurological testing. For motor, we're going to do L2, L3, which is quad extension. L4, which is dorsiflexion. L5S1 is hamstring flexion. For sensory, we're going to do L2, L3, L4, L5, and S1 is out on the lateral side. And then for reflexes, I'm going to have you sit up. For L2 to L5, we'll do the patellar tendon. They're going to relax. You're going to use the broad end of the reflex hammer right in the middle, actually right at the joint line. And you can see a little bit of a response there. And then she can lay on her tummy. We can do L5S1, which is the Achilles tendon. And she's going to have to relax her foot. And right mid Achilles tendon. And again, you're going to look at that slight plantar flexion. Excellent reflexes. All right, you're going to flip over. We're going to do some of our special tests. We're going to do 2 tests for the meniscus. First one is you're going to lay back. We're going to do the McMurray's test. So with meniscal tests, again, we're trying to compress a joint and then rotate to see if there's any torn pieces of meniscus that would get caught in the condyles. So I'm going to put my hand on top with my fingers on the joint line, my other hand's on the bottom. I'm going to load, and I'm going to, as I extend out, I'm going to push a valgus stress on the knee. So I'm going to push medially on the knee as I'm extending it. That makes a valgus stress. And then I'm checking the lateral meniscus. And I'm going to press up, and I'm going to press out on the knee, doing a varus stress, and that's going to check the medial meniscus. And then I'm going to do the Apley's compression and distraction, so she's going to lay on her stomach. I'm going to bend the knee up, and again, to check the meniscus, I'm going to load the joint and internally and externally rotate. And to see if it's not the meniscus, it's actually other structures like soft tissue, I'm going to unload the knee and externally and internally rotate. And again, making sure you're rotating the lower leg and not just the foot. All right, Wilson's sign is, she's going to sit up. Checks for osteochondral defects. Those are defects in the articular cartilage. You can just get forward just a little bit. I'm going to internally rotate the affected leg and then extend. And a positive sign would they would actually have pain during that extension. And right at the point they had pain, you're going to have them go to neutral and see if that pain goes away. The next one are, the next 2 are IT band tests. You're going to lay on your side facing this way. The Nobles test, you're going to put your thumb, you're going to find the lateral epicondyle and the IT band, and you're going to put your thumb right over those 2 structures. And then you're going to have her extend and flex her leg and see if that additional compression identifies a tight IT band. And you'll feel popping or clicking or pain. The second one to check for IT band test is to make sure that you have your top hand right on her hip so it faces straight up and their hips aren't moving around. Your hand is going to be under her knee. Your lower arm is going to be on her lower leg. You're going to bring the leg up, back, and around. That unlocks the IT band from the condyle, the greater trope. And then you're going to have, just scoot your arm back to the ankle and see, let the leg relax and see if the IT band is tight. If the IT band is tight, this is a little bit tight, it won't actually release down. A loose IT band would probably release down like that. The last 2 tests are for the patella, and you're going to lay on your back. Patellar apprehension test checks for subluxing patellas, and what you're going to do is go on the medial side and glide the patella laterally. And again, you're looking for them to contract their quad and be nervous that that would be, that they would have had subluxing patellas. And the other one is for conjugal malacia. This is Clark's sign. Can be an inaccurate test because people can just have a lot of pain under their kneecap. But we can try this. So what you're going to do is you're going to put your web space between your thumb and index finger. You're going to glide the patella inferiorly. And when you have it inferiorly, you're going to hold it there. And as you hold it, they're going to contract their quads. And you're looking for any pain or grinding in that. That's it.